Hey guys, me Hunter again. I'm back to show you something a little premature. Um, my 2.5 weeks post-op surgery reveal. Um, don't get too excited. It's a work in progress. Uh, but hey, I still have to wear that compression vest. 2 more weeks at least. Um, the surgeon wants me in the vest. She said all of her patients have to be in the vest 9 weeks, which surprised me because I didn't even know that that's how long I'd have to be in the vest. So it's a killer uh, because there's so much swelling. It help the swelling go down and keep everything in place as it's healing. I'm a work in progress. That's what she told me. I've had 2 visits with her after the surgery. First one was to get the drains out. The second one was recently. Um, she just wanted to see if there's any infections, how everything was coming along. To tell me I had to be back in the vest because that's just her rules, and I'm trying to abide by the lady's rules. So I'll show you what's going on here. Viewer discretion advised because I did have major surgery and there's a little bit of leftover blood. I know I'm not standing up, so I'm sitting down. I could stand up, but I think I could just show you the results. Um, just by doing this. See, they're gone. I do have some swelling on the sides. Well, they're swelling according to the surgeon. I can tell right here, right, right on the sides. See, you can see. I should take my shirt off, I guess. I don't know what this is on the side. Kind of sticks out. She thinks that's going to settle, was her word. Everything needs to settle down. And the sides will go down because I was concerned about that. As she said, nipples look great, by the way. I like the nipples. And this shirt is extra small. Not that I think I'd want to wear extra small even after the swelling goes down, but just want to see if I could wear an extra small shirt. I'll probably wear medium shirts, probably what I'll wear. What was I gonna say about the surgery? Well, I did ask questions. I do ask a lot of questions because I want to know. I asked her, well, what if that swelling doesn't go down to my liking? Well, she thought it would because she's never had to do a revision before. And, but I asked her what would that be in detail, like give me the details. And she said, well, she'd have to do liposuction, is what it's called. Um, then she'd have to cut some of the skin because there'd be skin hanging down, but she didn't think she's going to need to do all that. But we'll see. Um, and I'm supposed to go back and see her in a couple months to see, how much swelling's gone down, blah blah blah, and if I need a revision. But because I really don't want to go back in and have it redone, and basically it would just be touch-ups on the side anyway. Um, but for me, it's kind of a lot. It's a long drive. I'm more concerned about the drive than I am the surgery because it's a long drive. It's 5 hours, and it also depends if my insurance wants to pay for it. They might not do. They may not pay for a revision. Therefore, I'd have to pay out of pocket for the revision if I get one. So I'm thinking ahead of the game. Uh, she's not thinking too far ahead. She seems pretty confident in what she's doing. We'll see. But that's my 2.5 months. I want to show you guys, and it feels great to have my chest removed because I was very uncomfortable with it. That's how I felt. Some people are telling me that they don't mind having a chest. They just use a binder and they're fine. But I wasn't. I was one of those that I just wasn't comfortable. Always happened to wear a large shirt and really fit me. I'm not that big of a guy. I'm actually a small, kind of a small person. Because somebody said, well, it was on their video. Well, if you're older and you got a lot of weight on you, like you're a fat guy, that's what they said. Don't expect miracles. You're probably gonna have a lot of fat left over. And but I'm not real heavy set, so I think my problem is just I think I had a big chest because I have a big chest. There was a lot left over underneath my arms. That's if that's tissue. But swelling. That's probably why I have more swelling. I really don't know details of why there was more swelling with me than some people. I think other people they're just smaller chested. Correct me if you know something different. Like if you want to put in the comments below, hey Hunter, I'm small chested and I still have a lot of tissue under my arms, I need a revision, blah blah blah. Let me know. I'm interested. I have watched videos on people that were young, like 18, getting revisions because the surgeons they just did a botched up job. I've watched a lot of botched surgeries. They look pretty bad. Like somebody had nipples that were like this, like huge, these huge nipples. I couldn't believe what I was looking at. Like, why would a surgeon not cut the nipples smaller? But I made sure that my surgeon did. I did tell her. She did a 3-hour surgery on me, but she usually takes under 2 hours. So I know she worked hard on me, and I do appreciate it. And I told her that. I told her she did a good job, and she said, well, it's coming along. Like it's not there yet, but it's coming along. So she wants to see me again, which can't wait for that, because then I'll know for sure what's happening with my surgery. Hopefully it's the last visit there, and I won't need it to go there anymore. And then I can work on my lower surgeries. That's if I'm up for that. Right now I'm in recovery from top surgery. Now there's a lot of guys that I've seen on social media. They're acting like their top surgery was a cinch, like it was just cosmetic, like they got a tooth pulled, and I didn't really quite believe that. I mean, maybe for them that's the way they felt, but I wouldn't give that kind of advice out, that that's just like getting a tooth pulled, because it's major surgery, and it does take a while to recover from that. You're not going to recover like in a couple days from a tooth swelling or something. No, I don't believe that at all. I don't know why they'd say that. So yeah, as my friend was saying, his mother had a knee replacement, and it took 6 months for the swelling to go down. I'm like, 6 months? Like, I can't wait for that. Yeah, so I mean, it's swelling. It's everything's got to settle. It's major surgery. Don't forget it. In case you haven't had your surgery yet, and you're thinking it's going to be a cinch, because it's going to be like, getting a tooth pulled, or I'll just need a little Motrin. You don't know. I mean, maybe yours will go that well that you'll just need a little Motrin, but I think you're going to need some. They do prescribe, at least my surgeon did, heavy pain meds. I know it seems like I'm on them still. I'm still on Motrin though, which you can get that at the grocery store, but I actually got ibuprofens for swelling. Not sure if it's working that well. Makes me a little sleepy, but I think it's just a matter of time, and that's what I'm waiting on. But I do like my surgery. Um, I can't go out yet, just wear a regular shirt. I mean, I can, but I was told not to. I'd be scolded, and I want my surgery healing to go well. I want to recover well, so I don't want to go out and just hang out with, like I'm doing right now. But I'm just taking a break. I just took my compression vest off and thought, I guess I'll do, a video. That's why I'm sitting here like this. So yeah, take care. Put in the comments below if you've had your top surgery and how it went. If you want to tell me all about it, I'll be here reading your comments and responding. What else would I gotta say? Yeah, next time I show my top surgery, no matter what, I'll show you. I'll try to stand up and show you. But that's just, I have to use my phone to do that, and blah blah blah. That takes longer to upload. So I just want to do a quick video for you, show you a little bit how things are going. Now the middle, I forgot to tell you the middle part. That looks messed up, but it looks like I got shot. Like it looks like a hole there. It's like, well, I'm laughing because that's like I wouldn't even go out and get the mail with shirtless because it looks like I got shot there. But it's I don't know why. She said that's just the way she does the surgery. She makes sure to make the incisions to go up into a V, and that's just the way she does it. I asked her, should I put scar tape over the incisions, and she said absolutely not. She doesn't do it that way. So she has her own way of doing things. Sometimes it looks like it's coming apart, and it is falling apart, but it looks like it's staying in place. And that's the main thing, is that it stays in place. You don't want to come split open or anything and end up in the ER. Don't worry, you won't. And if you have, put in the comments below. I want to know. I want to know if you just get split where I had opened up. No, I'm not trying to scare you. But yeah, I'm happy I got it. Being a little impatient about the swelling. Other than that, things are going well. I'm able to sleep on one side, sleep on my back, sleep on my side. It hurts to sleep on my side, but I do it anyway. And I can do it. It's not so excruciating that I can't sleep on my side. I do. I'm gonna go, but thanks for watching. Please subscribe to my channel if you want to see more updates on my top surgery or anything else. And I appreciate it. Peace as always. Hunter out, and I'll talk to you next time. Bye.